Are there any other signs or symptoms that someone living with COPD might want to keep an eye out for to maybe consider calling for a office visit or maybe even emergency services?
Absolutely. So if you think about chronic obstructive pulmonary disease again, as I mentioned, as a chronic lung disease, the symptoms most commonly that come along with that are shortness of breath, cough, phlegm production, and sometimes a wheeze as well. So those are the three or four things I tend to think about. So if you're having difficulty breathing, which is really another way of saying shortness of breath, that's obviously an opportunity for you to say, I need to call my doctor or other healthcare provider to see what is it, that I need. If you're coughing and the amount of cough has gotten worse over the last few days or a week or two, that's also a sign that something's going on in your lung. Sometimes when you cough, you might bring up more phlegm as well. So I would say if you're having more trouble breathing, if you're having more cough, or you're bringing up more phlegm than usual for you, it's time to talk to your doctor or the healthcare provider to see if you need to do something different. Obviously, at its worst, sometimes people have problems with their lungs that it gets to the point where there's dangerously a problem. So if your fingernails start to get blue, your lips start to get blue, or you're getting dizzy, or you're really kind of in a distress, then you really need to be calling 911 to have someone come in and take you to an emergency room or a hospital. But I hope that your patients listening to this really don't wait to the point where it's really a sort of an emergency. I think if you're basically having more shortness of breath than usual, more cough than usual, or you're bringing up more phlegm than usual, that's a sign you should be talking to your healthcare provider about, what do I need to do? These are the problems that I'm having.